Nurses across the country are on strike on account of work conditions which they say will make their sacrifice worth their while. NTV's Charity Mwangi visited a health center and brings us the challenges they face in the execution of their mandate closer home. The blessing of bringing life into the world can in some cases feel like anything but a blessing. The horror and frustration of the process for some mothers adds to the pain and steals from their joy. Part of the difference is the nursing care they receive. Earlier today, NTV visited a Nairobi County Government Health Center to understand the great responsibility a Kenyan nurse bears in light of their circumstances. Here we find one patient nursing her one-day-old baby, whose delivery was a great challenge, more so with just one nurse to help her.
Mtoto amefika na naambiwa nishuke chini nitembee, na so siwezi tembea na mtoto ni kufika amefika. Nikadeliver mtoto. Sasa hakuna mashini.
This is her third child and the experience is different from her previous ones.
Usiku yote kuna mwenye ako naye. Kama sometimes kudeliver tumbo inakusumbua, kuna mwenye anakushikia mtoto unanyonyesha, unaletewa uji, unaletewa kahawa, chakula mpaka venye utatoka.
She acknowledges that the nurses are not to blame, as they have to do with the resources that are available, sentiments that are echoed by this nurse whose identity is withheld for her security.
All the patient know is a nurse. A nurse is supposed to provide everything, including food, including linen, including medicine. When you are in the facility and you tell a patient to go and buy drugs, they are telling you you're hiding drugs.
She tells us that many are the times that they are forced to dig into their pockets to support patients who are unable to meet the cost of basics which some of the health centers lack.
Patients are left in the mercy of the nurse who cannot afford, who cannot even provide, even for herself, but the citizen, they want so much from her. They tell you, sister, hata sijakunywa chai, hata hizi ndawa umenipatia nikakunywe, sijui nitamesa na nini. So you even feel for the patient. You go get your 50 bob, give the patient maybe to go and buy something to eat.
The situation gets worse when the patient has to be referred for emergency services.
You ask for an ambulance, you are told there is no fuel. Well, it is in the garage. Whose fault is it? Is it the nurse's fault? When does the government have to punish nurses for their own burden?
The messiness of their job and the difficulty in maintaining the white color of their uniforms presents a challenge which they say is not sufficiently covered by the uniform allowance.
You put on a uniform, you must have a uniform for tomorrow. And when it comes that a patient, maybe there's a lot of blood and you've messed yourself, you are soiled, what do you do?
The strains and conditions of the job have taken a toll on the nurses, leading to depression, broken homes, and imbalanced lives.
Nurse ladies, they have lost their families. Their husbands have gotten married to house girls or even neighbors. So what we are experiencing is that the government doesn't appreciate even those hours you are sacrificing.
At one point or the other, we are in need of medical services, and if you cannot afford to go to a private hospital, you may be forced to go to a government health center where you will place your life in the hands of a disgruntled nurse whose greatest challenge would be to shelve her personal feelings in order to take care of the patient at hand. Charity Mwangi, NTV.